So gang, welcome to another webinar about the COVID-19 response. We had a few technical challenges there just getting started, but it's great to be with you for a second time as we are launching our roadmap to recovery. Hopefully, presumably, we're not meeting for the first time. I know many of you were on our first webinar, which was back in March, which feels like a long time ago, 7 weeks ago. We were talking about a crisis response to this phenomenon that we barely understood where it was going to take us. And of course, we now know a whole lot more about COVID-19. We have been going through a whole range of crisis management scenarios. And tonight we're specifically talking about where to from here as we plan our recovery. We got a lot of feedback after the last webinar. There were literally 500 or 600 people registered for that. We've had lots of questions offline. And so tonight we really want to make the focus of trying to get to as many of your questions that you might have in the second half of our webinar. And so please get ready to start logging your questions even as we're presenting some of our early framework for recovery. And we'll try and do our best to get to them in the second half. There has been a whole lot of great stuff going on around our industry in the last 2 months. Quick shout out to Jack O'Brien and Jade Scott and Nick Schuster and the APA, the Australian Physio Association, the New Zealand physio groups. There is so much activity online. We would encourage you to be part of those conversations, to be working through the wealth of information that's coming through there. Of course, you have to, like with all mining for gold, prospect between some of the noise, but there's some really good content there. Quick shout out to the APA for their clever COVID marketing LAM kit. LAM is that local area marketing strategy that they put out to help you as independent practices. These are all the sorts of things that have been happening in the last few weeks to try and equip and enable allied health practices out there in the industry. What we want to do tonight is we want to give you a peek behind the curtain into what the Back in Motion Health Group here in Australia and the Motion Health Group in New Zealand are particularly planning on doing over the next 4 to 8 weeks. And to the extent that you can copy and paste, adapt, make it your own plan, we think there will be some value in that for you. Now, if we haven't met before, my name's Jason Smith. I'm a physiotherapist. I'm the group director for the Back in Motion Health Group in Australia and New Zealand. Across our network, we have over 100 locations, about 70 practice owners, something like 600 staff. And so recovering from COVID is a crucial endeavor for us. To my left here, I have the very handsome Dr. Justin Groenwald. Justin has a background in law, HR. He really is our senior leader in people and culture within the Back in Motion Health Group. He is our leader of the COVID-19 task force, which he may have taken on under some assumptions it wasn't going to be a long pandemic, and now he's stuck with that role. And he's the author of our roadmap to recovery. So great to have you with us again tonight, Justin. And if it's not a big ask to have him come twice, tonight it's actually his birthday as well. So I'm not sure how many of you would plan on spending your night of nights, that one evening in the year where it's all about you, with hundreds of people online, some of whom or most of whom he's never met, but that's Justin's gesture to us tonight. So happy birthday, buddy. We won't sing, we won't make a fuss over it, but you literally do not look like you are a day over 46 years. So you are doing very well. We also have online tonight very intelligent, very energetic Andy Ross. Andy is our director on the ground in Auckland, New Zealand. He is leading a whole team of practices over in New Zealand, and he is going to be on standby tonight if we get any New Zealand specific queries. And we know for our Kiwi friends, it's very late where you are right now. So we promise that this will be a short, sharp hour, and we'll try and pack as much value into it for you as we can. Okay. COVID-19, it's almost just rolls off the tongue now. We all know what we're talking about. It's hard to believe 2 months ago, this was just a thing out there in the wider sphere. And now it's something that we all have had a personal encounter with. It has changed our business. It's changed our homes. and it's changed our countries. With that said, given we're mostly tonight talking about the Australia and New Zealand context, I think we should all be breathing a massive sigh of relief to think how far we have come as two countries. Our governments have been proactive, they have been agile, they have been strict in some of their protocols. We have had lots of hygiene and physical distancing and patient screening and contact tracing policies put in place, and effectively that has commenced to work. We have achieved what we set out to do, which was start to flatten our curve. We really are living in two lucky countries when you look at the global landscape right now. If it's not already clear to you, we are now at that point where homes, businesses, yours and my practices, and the economies of our two countries are now opening for business again. And we want to just step through how that might impact us all in the coming months. In the last 3 days specifically, we have had the Prime Ministers of both countries, Scott Morrison and Jacinda Ardern, pass down plans for recovery. They have been very specific in their framework. They have also given, in Australia at least, the different states and territories the sovereignty to pace themselves based on their own needs and demands. And what this is creating, I think, for practice owners is a degree of ambiguity and some greyness in terms of some measures with regards to how we get back to a version of normal. And so tonight we really want to try and address some of those lingering questions to the extent that we have any insight. The one consistent message underlying all of the states and the two countries of Australia and New Zealand, regardless of at what stage of their recovery plan, the theme that keeps running through is that the restrictions are now lifting. So we need to be ready. You and me, we need to be ready in our practices. With all of the encouraging signs of life around us, I'm starting to hear, when I move around other practice owners, lots of questions, some of which we'll try and get to tonight, that don't quite yet feel like they have an answer. For instance, will practice owners like us on the call, will we actually restore the clinicians into full employment that might have been stood down or even made redundant or let go? Will we quickly revert back to our same team size and composition like we once had? Or are we going to come back slowly, incrementally, and be very cautious over the next months or years to come? Are there some practices that will shut down permanently because of this pandemic? If so, what does that mean for the communities that need still to be serviced and the demand for healthcare around us? What happens if some of our various government stimulus concessions, like in Australia, JobKeeper, in New Zealand, other provisions that have been made, what happens if they get terminated prematurely because we're opening our economies quicker than we might have first expected? What does that do for the profitability and sustainability of our practices? What happens to the supply and the demand for allied healthcare? Will there be a boom following this pandemic and in this recovery months, or will people be cautious and it will be just gradual? Or in fact, will we stall for another quarter? Nobody has all of these answers, but they're good questions to ask. Is telehealth going to be part of the new normal? Is it now a fixture of our service modalities? And will private health insurers and other scheme payers start to recognise it as a legitimate form for treatment? Shout out to the APA and the Physiotherapy Research Council. Anyone in Australia hopefully knows that they are calling for your support in some telehealth advocacy initiatives. Certainly Back in Motion is throwing their weight behind those to try and get private health insurance to honour some of these rebate provisions. We could keep going. Are Australians and New Zealand's spending habits going to be different on the other side of this pandemic? You know, having gone without for a period of months, will that have changed their paradigm towards spending on healthcare? Is that going to go in our favour, or is that going to go against us? And of course, we can't forget that there will be a lot of very vulnerable people doing it very tough for a long time to come. Well after our economies are open and our restrictions have lifted, there will be some families in our communities who are permanently impacted. And what's going to be our response to that as healthcare professionals wanting to serve the needs of our local clientele? Lots of questions. So hopefully I'm stimulating a little bit of your grey matter. In the Q&A section, feel free to make comments, add suggestions, give us some of your experiences. We'll try and repeat that for the benefit of all of our friends online tonight. And of course, ask questions of your own. But we have to start somewhere. We have to start somewhere with this recovery plan. And the Australian National Cabinet and the Ministry of Health in New Zealand have given us some starting points. And even though we're not here to give you legal advice or distinct, specific professional instruction around your local situation, we absolutely want to explore some of these specific strategies around recovery. Long introduction, but I just want to make sure we're all on the call for the same reasons. So, Justin, let's turn our attention to some of the detail. You have now authored 2 comprehensive plans for the Back in Motion group, which we're sharing. The first webinar, we covered this crisis response plan. Why do we need a second plan? Can you just at least give us context for that?
Thanks, Jace. So yeah, at the outset of this pandemic, we'll remember that we had the group COVID-19 response plan. And that group response plan really served us as a crisis management plan. And it served us well. Our goal from that plan was to ensure that not a single practice is lost. And I think we can fairly confidently sit here tonight and actually say that that goal is something which we will definitely be achieving. In that plan, we kind of foreshadowed that we would need to develop another plan. In fact, it's quite humorous that we had one little line item in that plan that said develop a recovery plan. We probably didn't realize the amount of work that was going to go into that, which is what we have had to do over several weeks. But that recovery plan is really what we now refer to as our roadmap to recovery. The recovery plan really plots a way for us out of this economic and social impact that the pandemic has had on our business and obviously our clients and our people. It's important to also know that our plan is not cast in stone. As we continue to work through the recovery, we expect to be making some tweaks and changes to the plan because we are living in a fairly dynamic situation at the moment. Now, our plan has a framework, and that framework consists of what we refer to as 3 pillars. It has got 4 focus areas and 3 levels. Now, that might sound fairly complicated, and we'll work through that in the next few minutes. But the important message that we want to leave with those who have joined us online tonight is have a plan. Because without a plan, you're not likely to succeed in your recovery, but be intentional about having a plan.
Great. So this is the plan Justin's referring to. It's our roadmap to recovery, a distinctly different document to the one that we would have circulated 7 weeks ago. And of course, we will send a copy of this around to all of you early tomorrow for your own reference. It doesn't matter how many slides we flash up tonight and how many strategies we talk through. There's no way we can cover the detail of this in an hour. So we'll send it to you. And then, as you've said, Jay, that becomes at least a starting point for you to adapt your own local practice plan. So let's move then just into these 3 pillars, because the crisis plan had 3 pillars, but these are a different 3 pillars. And we don't want it to sound like corporate speak. We just need a plain English version of what do we mean by these 3 pillars.
Yeah, so 3 pillars are really restore, relaunch, and reimagine. And we wanted to understand what are the things that we've, during this whole pandemic, we've stopped. And really those are the things that we need to restore. A great example of that is classes. At some time we will just start that up again. Relaunch are those things which we've perhaps stopped doing a while ago, but we want to kind of polish off, perhaps do some remarketing, introduce some new tools, and really reintroduce into the business in perhaps a new and revitalized format. So our GP referral program might be a good example of one of those things that we want to relaunch. Reimagine is really one of those things where we want to use the pandemic as an opportunity to perhaps move our business into the next level. We're going to be in a new normal. It's going to be a different world, and in that different world, we need to seize the new opportunities which come along our way. So already we've been using telehealth, but we want to perhaps use telehealth in a more proactive and targeted way going forward.
Okay, so we're hearing really that there's three lenses through which we can view all of the suggestions and ideas coming out of this recovery plan. Some are just turning on the switch again, others are refining some strategies, and then we've got this innovative space that we can be creative and new and different as we come into what some people are calling a new normal. So hopefully that makes a little sense as you go through these suggestions. You are looking through the right lens across each of the strategies. They're not all going to be right for you. And of course, you're going to be able to think of many more, but there's a good framework of pillars to start with. Now, Jay, we have these 4 Ps as areas of focus. Just explain the 4 Ps before we get into some of the detail.
Yep. When we develop a plan, we want to be sure that the plan actually covers the full ambit of our business. So any plan that gets put in place, whether it's our own or whether it's those that have joined us online, needs to ensure that it covers top to bottom. So our 4 areas of focus really relate to our patients, people, practice itself, and programs. So let me just explain that. So patients obviously is self-explanatory. Those are all the perhaps referred to as client-facing activities. Anything that relates to dealing directly with the patient. People really relates to our workforce. There's a whole lot of activities that you would do in your daily basis, or that's part of your regular business that will relate to the people that work in your business. When we think of practice, we think of all the operational activities, the day-to-day stuff that you'll be doing in your practice to really make your practice work on a day-to-day basis. And for us, programs is really those initiatives, events, campaigns, the perhaps group-wide things for us, which help us continue to grow our business. So anything that those who are watching us, joining us on this webinar, are doing in their practices to continue to grow their practices, that kind of falls in that programs bucket. So those are really the 4 focus areas. If you're covering those focus areas, you know your plan should cover the full ambit of your business.
Okay, great. Now when the crisis first caught us by surprise, things felt like they escalated really quickly. I can remember a particular weekend where my phone would have run off the hook 24 hours as practice owners all around the 2 countries were kind of wrestling with what do we do and what's going to happen next. It felt like things were out of control really quickly. There was desperation, anxiety, fear. The restrictions were starting to come in. And so it was kind of like a puff of smoke. It feels like in the recovery, it's not going to be so much that it's fast and furious. It's going to be slow and measured, but it doesn't necessarily mean it's not going to have confusion. So what are you thinking, Jay, in terms of the 3 levels that we might need to work through as we de-escalate into this recovery?
Sure. The 3 levels that we've actually built into our plan is really about timing. It's about knowing what to do when. So in a sense, it's about prioritizing. And I think we've used the analogy of catching a wave into the beach. It's knowing the right wave that's going to take us all the way into the beach. As you rightly point out, various jurisdictions are going to apply their recovery plans at various speeds. So our roadmap needs to actually cater for the fact that different jurisdictions across our group will move at different speeds. this plan needs to be applied, therefore, on a jurisdictional basis. This plan we don't see as a plan which simply is a one-size-fits-all across the group, because every jurisdiction is going to do things slightly differently. For instance, we can already see that WA have got 4 phases to their roadmap, whereas others might have 3 steps, and in the federal space, there's 3 steps. In New Zealand, there's multiple stages. Our plan in terms of our levels also have what we refer to as predictive indicators. And these are the things that, they're really the signs that we're looking at to help us understand when we should be moving from one level to the next level. So if I can refer to our plan, Jason, we've got, if we just have a look at our plan, we've got the 3 levels over there. And our predictive indicators that we're looking at include the national stages, the steps that our various jurisdictions are at. That's just one indicator that we'll be looking at. It includes, for instance, the AIS framework, the Australian Institute of Sport framework. They've developed that framework so we can understand, well, how's sport progressing? How's professional and community sport beginning to open up? And then we also need to look at internal factors. So those are the external factors. Our internal factors that we'll be looking at is our appointment rate and also our revenue. And so as we keep a close eye on those, we've actually identified what steps we will take and when we'll take them.
Great. So I really encourage you in your own practice, whether you're an independent standalone practice or a large group of your own, to think about what your predictive indicators are, because it will influence and inform the next suite of strategies that you want to be implementing in your recovery. And so in our comprehensive plan, there's a whole raft of suggestions, but knowing when to press the go button is going to be absolutely critical. All right, we need to get into the detail and then move on to some questions and commentaries from our friends online. I'm really interested in this comment, Jay, that I've heard from the Victorian Premier, where as restrictions are starting to lift, he says, just because you can doesn't mean you should. That is, when there is provision for certain services to resume, there still needs to be caution around how fast, how quickly. What are you advocating here, Jay? Should we be, as practice owners, going bullet agate, really charging into this? Should we be holding back? What's your mood around that, talking with owners all over the country?
Well, I think all the owners around the country need to first and foremost be looking at their jurisdictional roadmaps. So those roadmaps will, provide them with an understanding of what compliance looks like. But we always sort of say that there's the things that you can do, there's the things that you can't do, but then somewhere in the middle is the things that you should do. And for us, the interpreting of what we should do is really being fairly conservative. So by being conservative, what I mean by that is we want to err on the side of safety. And so our plan and our steps and our mood is really about erring on the side of safety. Jace, just recently, as recent as last week, in fact, we had a bit of a scare in one of our practices where we really thought that one of our physiotherapists had been exposed to the virus. We thought that was a real threat. Thankfully, that turned out to be negative in that instance. But one of the sort of things that, as we reflect on that incident, is we realize that we still need to be very cautious in our approach.
Okay, let's get into the detail. We're going to flick off the slide deck. We're going to make sure you can, really understand some of the granular of what's going on inside our plan. Obviously, you're not going to be able to read any of this from where you're sitting in your pajamas at home, but Jay, let's get into some of the specific suggestions that you've got listed here. Let's pick one of the P's, one of the focus areas, our patients. It's an obvious place to start. Just give us a couple of shout outs to some of the examples of strategies we might implement over the progression of stages.
Jason, as we put together our plan, one of the things that we did is we had a think tank. We got some of our practice managers together with some of our directors, and we kind of brainstormed some of what we should be doing in relation to the patient space. some of the stuff that came out there, which is what we've included in our plan, is to do client care training. Now, client care training might sound like something everybody's done in the past and so on. Everybody finds it important. But we thought that this is a great opportunity to run some training to ensure that our staff, especially our support staff, are well equipped to handle objections in a sensitive way, that they can make patients feel safe. Certainly as people venture out of their doors, they want to know that they can be safe in our practices. And there's that sensitive topic of asking people who are feeling unwell to perhaps reschedule their appointments. And so how do you do all that sort of stuff in a way that leaves people feeling encouraged to keep coming back and finding our practices to be a friendly space? So we're going to be doing some of that training. Added to that, we have a great CRM system at Back in Motion, a customer retention management system. Those who have joined us might have their own system, but we really feel that it's a great opportunity to train staff to make sure that they can use that system effectively, especially as we start doing activities such as client recall and so on.
Joe, let me stop you. Just go back to this customer care package. So you'll run some training around that and equip our staff. But what are we really talking about? And how does that get implemented in our local practice? What is a care package?
Yep. So a great example of making sure that we are caring for our clients. It's not just about the treatment, it's about the full service that they get from us. And one way that you can do it is to send out a care package to them. It's not just about caring for them when they're in our practices. So you could design something that could be a brochure of some sort, a small gift, a fridge magnet that really informs them how to look after themselves when they're not in the practice of receiving treatment. So there's a practical example of that.
Okay, great. Let's keep moving. And what we might do is we might just flick a couple of quick slides of a few of these pages of our plan, just showing you the level of detail you can expect to come to you overnight. But of course, we're just picking out highlights here. So let's go to our people, our team, right? This is the lifeblood of healthcare. We can talk about patient care all we like, but if we don't have our people, our clinicians and our support staff aligned, we're in a lot of trouble. How do we love them back into our teams as we're going through this recovery strategy and give them a future that they're excited about? What are some of your ideas there?
Yeah. And Jason, I might use this opportunity just to say thank you to our team out there, everybody who's a part of the Back in Motion group. We've just had so many stories of how teams have worked together. So that's been really great. So there's two primary ways that I guess I've picked out that I want to talk about. One is we want our workplace to be a safe place. That's always got to be our priority. And certainly in these times, we might have heard or seen a little bit about the COVID safe workplace plans that we should be putting in place. So our plan is to have a COVID safe workplace plan for our staff and to make sure that we train them in that plan. That plan needs to incorporate the national principles, national COVID safe principles. And for those who are watching, a great place to actually find those principles is the Safe Work Australia website. They've got a great array of tools and guides as well that they can make use of. A second area, Jace, is we want to do an employee engagement survey. And we actually did one at the end of last year, interestingly enough, and we had great results from that survey. But there's a lot of water that's flown under the bridge. And we can't take it for granted what people said about the employee engagement at the end of last year still is the same today. So we want to run a new survey. And in that survey, we really want to be asking questions. And if anybody else there runs a survey, you can do it in any format. You can do it in a simple format. But you're wanting to understand from your employees, are they getting the right information? Because the lack of information drives fear. What about their workloads? In many instances, workloads and work hours have changed. People have been operating under reduced hours, and often the reduced hours doesn't necessarily equate to reduced workload. So are people feeling under pressure, under huge load? You want to ask questions around that. And then, you want to ask the question about, are people thinking of leaving? Are they thinking of leaving their roles? Are they thinking of leaving the profession, in fact? Those are the sort of things you want to be targeting in an employment survey.
Yeah, it's interesting just talking with so many practices in the last month or so. There are almost two extreme experiences. There are teams out there for whom they would say their people have lifted and risen, and they have become, a real beacon of hope and optimism, and they're stronger for it. And then there are other practices for whom they would say this has just decimated their team. It's fractured people's confidence, and it's really left them without much of a pathway for recovery. So what I'm hearing with this survey is ask the right questions, be courageous, lead your team. Don't assume your people are all thinking the same thing. Be mentally prepared for as many off as those who are on, and try and rebuild some culture and momentum amongst your people. And I guess stand ready for a little bit of ugly in there as people wrestle with their own careers and future. But what you can't do is not listen. True. So to ask the question, listen, and then be using that information to help fuel some specific strategies then for your local team. There's so much more in that. Maybe in question time, Jay, we might come back and people might be interested to know, well, what are some of those really specific questions, those bitey, edgy questions that get really meaningful responses? So now let's go to practices and programs. So this is two other focus areas on our plan. Give us some suggestions around strategies there as we kind of think about these stages of recovery.
Yep. So Jace, I think a really important thing about the time that we're living in is that many practices would have taken a serious look at their costs and actually brought their costs down to adapt to perhaps the reduced revenue which they're experiencing. Now is the time to really ask the question of what do you need versus what isn't really a necessity in your practice. So before you actually start increasing your cost base again, review your budget, consider what are those things that you can actually live without now. And so what we'd be advocating for our practice to do is to revisit their budget now, and do so with the view to putting in some genuine cost control measures in place right now.
Personally, I think that is one of the best outcomes that we will all experience because of this crisis that we have lived through. That is more stewardship, better stewardship of our resources. There's really only three ways to turn a profit in an allied health practice. You have to grow your revenue, you have to reduce your cost, or you have to optimize the productivity of your staff. Every strategy falls under one of those three categories, right? And so, Jay, you are talking about becoming much more diligent and shrewd in those creeping costs. If any of you listening tonight are like those of us at Back in Motion, we have been reasonably ruthless in cost control in the last 7 weeks. So we have cut subscriptions, we have obviously negotiated with landlords, and in so doing, we've learnt there are on costs and things that we probably never should have paid. We can even consider how many of our staff we need to operate our practices, and so we're getting a bit of dialing up and down of optimal sizes and composition of teams. There is stock control and consumables and all sorts of things that I think we can be better operators of. And in the recovery, the last thing I think we want to do is just snap back to spending, particularly if you've got a bank full of JobKeeper proceeds, or in New Zealand, other concessions from your government, and have a false sense of security. You have an opportunity now to run a more profitable business. Don't cut the important services, but there's a lot of frills in our business. That's good, Jay. Anything else, particularly under practices or programs, you want to call out?
Perhaps just under programs, Jace, I think we mustn't forget that certainly for us as a business, it's not just about treating sore knees and so on, but we want to be able to make a difference to those in need.
Yep.
And so we mustn't forget that at this point in time, we also want to be significant in terms of making a difference. So what we want to do is, and we're all well aware of the fact that there's a high unemployment rate at the moment. And so what we want to do is really work out how we can actually make a difference in that space. And we think if we could do that in conjunction with our SOS Foundation. And so that's going to sit under our program. So we're going to explore that space in a little bit more detail as well.
Okay. So that's that idea of recognising you have opportunities within your local community that might sound charitable and philanthropic and social enterprise, which might not grow the economics of your business today, but they certainly help the community you live and work in to recover. And all roads that help your community ultimately help sustain your practice anyway. So this is a way of doing the right thing, things that we should do, which ultimately are going to build confidence in your practice and your team.
And Jay's a great way of doing that as well, just in terms of some practical advice, is really letting your local referring doctors know that you'd be prepared to do some pro bono work for those, especially those who are experiencing financial hardship.
Yep.
Or perhaps just sending out some sort of a care package to those who are experiencing financial hardship as well.
Fantastic. Now, time is moving, Jay, faster than we can talk. When I look at the plan in front of me, and you've been seeing some slides flick along there are so many other initiatives. We're talking about early recruitment strategies, because long before you need new people, you should be out there meeting new people, staff. You never want to start your recruitment when you need someone. It needs to be a proactive strategy. So getting in touch with universities, getting into the job shows, advertising for positions that you might need 6 to 12 months from now. We've got a whole lot more patient-facing initiatives around building marketing campaigns for the next 12 months. These care packages that you speak of. I think we want to reinvigorate the referrals from your local GPs and other hubs of influence. And so getting back in touch with them and telling the story again of what you've learned through this crisis and how you can help. These are really valuable initiatives. Maybe even starting to turn your attention to the creative and the innovative stuff of providing services at home to people, if that's not your normal model, providing ergonomic services to workplaces as people are returning to their desks, maybe having had a bit more of a sedentary month or two. I mean, I could just keep on going and going, because you have jam-packed this full of good stuff. You talk about EAP, which is really providing support services for staff who need to talk through the challenges they might be feeling at home, all of which builds an optimal team for you. But I'm going to stop, because time's marching on. You're going to have questions and maybe comments around this. So suffice to say, there is a complete plan, and your invitation is simply to read it, cut and paste out of it what works for you, add to it what you feel is contextual to your local business, and hopefully get some value. Okay, we want to turn to the Q&A and the comments section that you hopefully have been populating while we've been talking. In just a minute, I'll flick my screen across and see if there are any questions there. And we'll wade our way through them and do the best we can to make sure we get to at least the key themes coming through there. I can preempt, even before looking at the Q&A, that one of the hot topics is going to be, when can we commence classes? When can we start these group consultation services in our practice? I know it's been running hot online as a question, and even inside our group for a few weeks now, actually. That's been something of great interest. So I might start answering that one with this simple statement, that we obviously can't give you any clarity or factual information that hasn't been provided by the governments. Having said that, we try very carefully to triangulate our sources of truth and work very hard with what we can see from official government websites, as well as implementing the principles of safe practice in our allied health context. And I think it's important to remember that allied health services never got banned, not in Australia. In New Zealand, of course, they went to level 4 lockdown, and so face-to-face consultations stopped, but telehealth could continue. And so when it comes to classes, I would encourage you all to make a very clear distinction between therapeutically indicated healthcare services, that is rehabilitative group consultations, from what might otherwise be considered just fitness classes or sport and recreation services. You'll notice in at least Australia, they have not even mentioned healthcare in the restrictions because there haven't been restrictions placed on it other than overarching protocols around hygiene, hand sanitisation, social distancing, 4 square metre rules, patient screening, etc. So we feel very confident at Back in Motion that as your local states and territories, and in New Zealand as they go to level 2 of their de-escalation, that therapeutically indicated group consultations could commence once you get to that stage. In Australia, stage 1 or step 1 of the federal plan, and at every state level, whatever's the closest aligned to that. However, it's on every practitioner to make sure that you are fulfilling your obligations as a registered clinician, making sure you are doing a proper assessment, clinical record keeping, and that the services are therapeutically indicated. And of course, you're observing all of the other hygiene and distancing obligations that have been made consistently clear. So we don't think classes is as a red herring or conundrum as maybe others do. We're feeling very confident that we have a plan for that recovery. But I'm sure there are going to be many other questions out there. Let's turn our attention to some of your questions. There's a few happy birthdays, I think, to you, Justin. So well done, buddy. Somebody's asking, will the access for the recording of tonight's webinar be made available to everybody? And the answer is yes. So we will do our best to render that and get it out to you tomorrow with a copy of the plan, and of course our contact details if anybody wants to follow us up in their local context. Do you have any advice on how we can encourage our staff, Jay, to download the COVID Safe app? Now, we've had a lot of discussion about this inside Back in Motion. We think this is a really important part of our recovery plan. So, Jay, I'll let you comment to that.
I think ultimately the COVID Safe app actually does provide us with a greater assurance of safety in the workplace. Now, so I think an important way of actually encouraging it is to talk about it from the context of safety. I spoke a little earlier about the scare that we had just recently, you know, we were very fortunate that the tracing worked well in this instance, and that the person who we were concerned about that had potentially exposed us to that virus had contacted us to let us know that that's the case. But had they not, how would we have known? And if you think about it, our physiotherapists who are exposed to their patients for 20 or 30 minutes at a time, the COVID Safe app could be a great device that will help us keep each other safe.
Yeah, fantastic. So we are really supportive of this federal initiative. We think it's an important part of our recovery. We're having another question here just regarding loosely what might be called classes. This person's describing them as one-on-one clinical exercise sessions, particularly focused on group reformer classes. I think the principles of what I just spoke to, we would apply to your question as well there, bearing in mind that you need to have those very strict protocols no matter what class format you might engage in, around social distancing, the 1.5 meters, the 4 square meter rule. So the size of your facility or studio is going to be prescriptive of how many people you might be able to engage in these services. The fact that you are screening these patients before they attend so that you're not putting at risk any community spread. The COVID Safe app is going to be essential if there is any contact tracing that's required after the fact, ensuring nobody with symptoms in your staff are working there. I mean, all of these things have to be in place, and assuming your geographical jurisdiction has in our opinion, reached something akin to step one of the Australian recovery model. We think if it's therapeutically indicated and not fitness orientated, that you can commence those group consultations. That's at least the plan we are putting in place for ourselves. We consider ourselves to be pretty conservative and cautious, and in fact, many within our own group have pushed hard against us on this, but we think that's right for being beyond reproach. And obviously, as we learn more with you, we can let you know if our position on that changes. Jolene's asking, what is NSO? So clearly, if you're looking at the slides on the screen, NSO is an acronym. We apologise, that's internal speak that stands for our Network Support Office. So Justin and I are sitting at the NSO right now in what's called the Forest Room, and this is where the support group for Back in Motion in Australia and New Zealand live day in and day out. So we would encourage you to replace NSO with ownership or the management team of your practice, or if you have an advisory group, a lawyer, an accountant, a business coach, somebody of that nature, then you'd be wanting to use them as a resource in your plan anywhere you see we have NSO. Okay, we want to talk about staff, Jay, and in particular wages. And I think as people are coming back to work, there's a question, do you have strategies to ensure that you're demonstrating equity of hours and income opportunities as your staff start coming back to work and the load increases? You know, there's this kind of tension around, do we bring everyone back at the same rate, or is there kind of mixed speeds? Can you comment to that?
Well, Jay, certainly in our plan, we've actually put in I think it's at least two of the levels that there will be a review of the staffing levels. In terms of our escalation process, we've used variation agreements whereby staff hours were reduced. We didn't reduce the wage rates. We reduced the hours. So what we would be advocating is that, and that's why one of the reasons why we'd be watching the appointment rates very carefully, is as those appointment rates increase, keep your staffing ahead of those appointment rates. So once again, lift your staffing levels using variation agreements in advance, so that you've got the capacity to continue to grow back to where you were.
Fantastic. There's a few more questions regarding classes and group consultations, and so I'll just skip over those, hoping we've addressed that already sufficiently. But please contact us offline if you still feel confused. Somebody has linked you to the APA position statement here in Australia on that, and of course we have access to that. I sit on an innovation group with the APA, and I'm sure if there is ongoing confusion there, we will seek clarity for you. We have a question from Brock. He's asking, as a franchise, because Back in Motion here in Australia and the Motion Group in New Zealand is a franchise group of practices. As a franchise, is the franchisor revenue decreased, and have we found franchisees wanting to leave our group? And if so, what sort of assistance have we provided them? So that's a very commercial question. We don't mind telling you a little bit about our story. When we first entered this crisis, we made a very strong sentiment to our group that it was our intention that there will be no practice left behind, that every one of our franchisees, we call them practice directors, every one of the owners within our network would endure this. And so for some, that meant we had to give them an enormous amount of financial and operational support. And for others, they have actually had, it almost beggars belief, but they've had record months of trade during this period. And so they've been very gracious to allow a skewing of resources in the favour of those who needed it most. But on the whole, we have had no practices go under. We will bring all of our practices through this. There have been some in distress. They have been given a lot of concessions. Across our network, I think we published a total package of relief that equated to $1.5 million spread across all of the locations. And we think that will be sufficient with all of the other government stimulus measures to ensure that we are strong on the other side. And I think rather than me speak on behalf of otherwise how the franchisees feel. Happy to always give you a list of every single director in our group, and you can ask them yourselves and get their own story, because I think that's far more meaningful. Thanks, Brock. When you treat, you shouldn't or don't have your phone on, so the app doesn't help. So that's a statement presumably meant as a question. Is there a means around how you can navigate that? When you're treating a patient, you shouldn't have your phone on. How's this app going to be meaningful?
That's a great question, and I don't know the technical detail of the app in terms of whether if your phone is off, if it still does work or not. But if it doesn't, it might not necessarily be those who are treating the client as well. It might still work for those who are perhaps at reception or other staff as well who might have come in contact. We still think it's worth advocating for. We think it's better to have it than not have it. I don't personally. I have downloaded it. I don't think there's any particular negative. There can only be a positive to come from it.
Carolina, my quick suggestion, because I totally agree, you should not be answering your mobile phones when treating your patients. They should be getting your undivided attention. My suggestion would be you have your phones left at reception. That phone is going to be effectively in the vicinity of every patient that comes into your practice by virtue of them passing through reception, and your support team can obviously hold your phone if that is a practical solution. Can we give any specific tips regarding marketing, particularly attracting new patients? Well, the good news is every stage of de-escalation in this plan has a wealth of marketing strategies being suggested. So it's clearly not going to be one thing. But in terms of attracting new patients, if I was to give you from my own experience, 20 years in running practices, I would be saying reach quickly for the low and no cost initiatives of pressing into the relationships in your community. So getting into those spheres of influence, those hubs of referrals, making sure the story of your practice as being a strong supporter of the community is being heard again, welcoming the referrals from your local sporting clubs and chemists and doctors and schools, and really ensuring that people haven't forgotten you in these slower 2 months. And especially, I would be promoting that you have a 12-month calendar of local area marketing initiatives that touch on the digital space, that touch on the local area marketing space, that you can build resourcing around to be able to ensure that you're not reactive, but you're in fact very calculated, very measured, very intentional. And of course, it's back in motion. We're fortunate we have a whole team of marketing execs to do that for us. But if you are a local independent practice, maybe you get together with some other colleagues in your area. Don't worry about competition. Actually think about collaboration. The APA have put out that COVID-friendly resource pack. And if you're really stuck, I'll put you in touch with our marketing executive. So there's a few suggestions to get you going there. Another question around staffing, Justin. We have reduced our clinical staffing as part of the crisis management. We plan to increase those hours gradually. Is there anything we need to consider in regards to the legal aspects of HR as we gradually increase? I know you've spoken to some of this already. Is there anything more to add there?
I think the main thing is to use variation agreements, which is what we've done. Remember that when you have a contract of employment, you need to change a contract of employment with a written agreement. And so we've used those, what we call variation agreements. We're happy to make those available as a resource as well. This is the ones that we use. But make sure they're in writing and really work with your team members to make sure that you're increasing it in a way that works for them as well.
Great. Still on HR matters, because it's great to hear actually the questions around people, because recovery is more about your people than your patients. If you can recover a strong team and rebuild that sense of service paradigm for your community, your patients will return. There is no doubt about it. Sick leave specifically. So over the coming months, there will be a lower threshold let's be real, for team members to call on their sick leave. So anyone with any symptoms that even remotely resemble coughs, cold, flus, let alone viruses, they're going to be asked to stay at home. That brings our practices to a grinding halt. What do you have to say, Jay, for Campbell regarding sick leave?
Well, I think let's remember that one of the key aspects of recovering as a nation, or being Australia and New Zealand, and one of the key things that the governments are telling us is now is not the time to soldier on. So if you are sick, if you are experiencing symptoms, stay at home, and that would be our message. And if people are sick, then they have the right to access their sick leave. That's something that you need to build into your budgeting process. The fact that you may need to have staff away more often, and consider that in terms of your staffing. So when you're looking at your appointment rates, consider the fact that you need to build in an allowance for sick leave and increase it even higher.
Great. And I might just pick this last question before we wrap it up, because I'm conscious of time. It's taken all of this time, Jay, tonight to get to this question, which I reckon 2 weeks ago would have been on everyone's mind. And in Australia, it's the JobKeeper allowance. So I know within the Back in Motion group, this has caused numerous staff endless headaches as they've managed multiple applications around JobKeeper. I think just before I got on the call, I heard that we had, of our 100 and something locations, 50 applications thereabouts for JobKeeper. Approximately half of them have already received their supplement. The other half are anxiously waiting, along maybe with some of you. And the news that we have received to assure us is all is well. It's just processing time, and we should have received everything by Wednesday this week. So if anyone is waiting for their JobKeeper commission, and assuming you've filled in all the paperwork correctly, maybe just rest easy until the close of business on Wednesday, because it looks like that should be the time at which everybody's caught up to speed. But with regards to Job Seeker, the question, Jay, is specifically the appearance of profiteering from JobKeeper. Some staff have taken issue with the fact that their employer is getting a $3,000 hit every month, and it looks like they're making more money than they ordinarily would. Any tips culturally with how you might handle that, particularly as we come through this recovery?
I think the key thing is that the JobKeeper is a wage subsidy that the government has put in place to ensure that the connection between the employee and the employer stays in place. Now, that might be fine to kind of argue that for now. There might be instances where an employer might be in a sense benefiting from that. But let's not forget that the pandemic and the kind of tail of this pandemic is going to last for many months to come. And so although the JobKeeper might give an employer a leg up now in some circumstances, that is going to be vital for the long-term sustainability of many businesses over the coming year or two.
Yeah, I think it's a good question in terms of the appearances. There's lots of complexity to the policy decision that was made around JobKeeper. Again, very happy to have more comprehensive discussion offline if anybody wants to follow that through. Okay, we need to wrap up. It's 9 o'clock in New Zealand. It's 11 p.m. and I'm very conscious we don't want to keep you any longer than we asked. So a few closing thoughts from me just as we wrap this up. Firstly, and again, a big thank you to Justin, not just because it's his favourite way to spend his birthday, but because what you're seeing tonight is like the barest tip of an enormous iceberg. The amount of work that has sat behind these plans is substantive. And we're very grateful, Jay, not just at Back in Motion and the Motion Health Group, but I'm sure everybody listening is getting some value at some level from it. So we really do appreciate the work you've put into this. Our main message tonight is that the recovery is commencing. Okay, we're not talking about this in terms of crisis management. The sky isn't falling, right? There is light now at the end of the tunnel. Restrictions are lifting in both countries and across all states and territories, admittedly at different speeds, but it's starting. And so you need to be ready. And we aren't dictating you a foolproof plan. All we are doing is encouraging you to have a plan, use some of ours if it helps, but mostly to provoke you to come up with your own ideas. It's really important we use this metaphor of surfing. I have a bit of fun with this idea that leaders are surfers, but as practice owners, you are surfers, and you need to plan your recovery like a surfer plans to catch a wave. Okay, you're out there behind the breaks. You've got to observe the set of waves rolling in, get into position, plan your takeoff, paddle like crazy. Once you're up on the wave, keep your balance, watch others around you, and try and enjoy the longest possible ride to the beach you can. Get as maximum value out of your strategies, and then out you go again. Find another strategy. Strategies aren't always going to work. You get dumped on a few, but the truth is catch as many waves as you can because they all make for a great day out in the ocean. The slides are going to be circulated, or more importantly, the recording of the webinar. So hopefully if there's stuff you missed there or you've joined us late, you can recap on some of what was missed. And really on that note, again, on behalf of everybody at the Network Support Office and all of the practice owners in Australia and New Zealand within our group who have all contributed to this plan, we are grateful. We hope you get value out of it. Have an amazing night's sleep. Have a great recovery as you really forge your way into some new strategies and reimagine what life is going to look like on the other side of COVID-19. Good night.